with him. It just takes a second or so to connect. Shabir, I do have you there, right?
I'm here. Can you hear me?
We're gonna connect in just a moment. Let's sort that out. Okay, we do have you there now, right?
Yes, I'm here.
Okay, thanks for your time. Most appreciated, right? So let's get some of the facts right here as it stands. Are we in a fifth wave?
So we're pretty much at the start of a resurgence based on the positivity rate that is being reported, which is above 10% for almost 2 weeks now. But at the same time, I think we just need to we shouldn't start panicking because we're in a very different phase of the pandemic compared to where we were during the course of the first 3 waves.
Perhaps it's a good chance to explain that. What would be the difference from those first 3 waves, or 4, or the 4th wave, and then now, even if the numbers go up?
So during the course of the first 3 waves, there were very few people that had protection against severe disease and dying from COVID, and especially high-risk individuals, because at that stage, the number of infections that had transpired before the onset of the wave was fairly modest, in addition to which there was very little vaccines that were being rolled out. And what has transpired in South Africa since then, and even before the start of the 4th wave, which was due to Omicron, was that at least 73% of the population were likely infected with the virus at least once. And then we had vaccines that were also being rolled out. And those two things put together resulted in a high level of individuals in the population that had protection, at least against severe disease and death, not necessarily against infection. And that's the reason when we had the Omicron wave about 4 or 5 months ago, there was a massive decoupling of infections, people being infected, and the risk of people going on to develop severe disease, because there was this underlying immunity that resulted from past infection as well as vaccine rollout. After the Omicron wave, we now estimate that probably 85% of South Africans have been infected at least once, and roughly about 40% have received at least a single dose of the vaccine. And most importantly, above the age of 60, at least 2/3 of them have received the vaccine. So those factors put together results in a high percentage of people having protection against severe disease, although we can do better by especially the high-risk individuals, people above the age of 50, getting vaccinated.
How do you come up with that 85% immunity? I mean, because I speak to you on the day we voted 28 years ago. It's not like you can vote each person, right? How do you come to that sort of figure?
Yeah, so what we do is we do random sampling in the population. So we go to random households and we take a spot of blood on a piece of paper, and then we test that for the presence of antibody. And the presence of the antibody in someone that has not been vaccinated would indicate that that person has been infected with the virus. So we just completed our 3rd sero survey, what we refer to as a sero survey in Gauteng. We just completed that about 2 weeks ago. And that 85% is the provisional results from that sero survey, where we sampled close onto about 7,500 individuals across all age groups, randomly.
Okay. Yeah, and I remember when we first spoke at the onset of COVID-19. I think you spoke about if we can get to that 2/3 immunity, we'd be okay. So if you're talking 85%, I mean that's well above the 2/3 threshold, right?
Yeah, when we were talking of the 2/3, it was on a very different scenario in that we didn't have this sort of variants that currently are circulating. With the wild type virus, the first variant that was circulating in South Africa, at that stage, we believed that if you could get to 2/3, you could bring about a substantial reduction in transmission of the virus. But that is before the virus started to mutate. And that 2/3 means very little now. It's a very different sort of a virus that we're dealing with. It's what we refer to as being antibody evasive, and that's the reason why neither past infection or even 2 doses of vaccine does much in protecting against infection due to Omicron, or even a variant that's currently circulating right now, which is what we refer to as a sublineage of Omicron, which is known as BA4. So right now, getting to 70% people vaccinated or 2/3, those figures are meaningless now. The most
Okay,
important
but
figure now,
that's so interesting. So okay, what is the most important figure?
yeah, the most important figure in my mind now is to get more than 90% of people above the age of 50 vaccinated. We would achieve much more doing that than getting a random number of 70% of South Africans vaccinated.
So you're looking at a specific age group. I mean, in terms of 90% at a higher age group, right?
Correct. And the main reason for that is not that only people above the age of 50 end up in hospital. There are other people in the younger age groups that could unfortunately end up in hospital, especially if they got underlying medical conditions. But people above the age of 50 have accounted for close to 80% of all of those that have died of COVID in South Africa. And they still remain the most susceptible to being hospitalized because they're obviously also the age group that are more likely to have underlying medical conditions, including diabetes, obesity, as an example.
Okay, Prof Madhi, and I've heard just recently in the last few days, sort of anecdotal, evidence from people rattling off example after example of people being vaccinated or double vaccinated in that case, right? And within a couple of days, things going wrong. Now, yes, I'm giving you arbitrary things. A person vaccinated, a few days later they're dying, somebody being crippled. I know it's difficult to say that, but I mean, are you able to can we do we have a large enough sample to say that people who are vaccinated are at risk from being vaccinated, not from COVID-19, because of other issues?
Yeah, I think we need to understand that right now there's 11 billion doses of vaccine that's been administered globally. 11 billion. That's more than the number of people on planet Earth. And if these vaccines were causing a mass number of people to die of COVID, as is claimed in some quarters, we would have known it would have been in your face. The problem of taking an individual as an example of a side effect of vaccine is that you've been completely dismissive of the other conditions that individual might have, which could also be temporarily associated with vaccination, but doesn't infer that the vaccine actually caused it. So let me give you an example. Someone that gets a vaccine today goes out shopping and gets knocked over a bus 3 days later. Clearly, that incident is not from vaccination. Similarly, someone with diabetes, who's got chronic diabetes, chronic uncontrolled hypertension that gets vaccinated today, that person dies 3 to 4 days later. That person probably would have died irrespective of vaccination, in that person probably ended up having a heart attack. That doesn't mean the vaccine caused the heart attack because the person received the vaccine 3 days later. So when these fatal events occur, they need to be adequately investigated, and that means a post-mortem needs to be done to be able to
Are they
exclude all
are they
other
are they
causes.
investigated? Because I think that's the fear factor I hear from people. Where, I mean, you're right. A person who's generally ill is ill, and I understand, and it comes with all sorts of pitfalls. But what I hear recently is the link being made to people who are sickly, but not really sickly, and some are pretty healthy. And within a few days of the vaccine, of the second vaccine, their situation changes completely. I mean, that's the sort of person I'm referring to.
Yeah, so the chances of getting a serious side effect from a vaccine, and there is serious side effects from vaccines, but the chances of that happening is in the region of about 3 to 4 per million of the population. The chances of having a fatal side effect from the vaccine is in the region of about 1 per million doses of vaccine, not million of the population, rather million doses that are administered. So 1 in 1 million doses of vaccines might result in a fatal side effect. And the type of side effects I'm referring to is what was previously talked about, this deep venous thrombosis, where there's clotting of the large blood vessels. And there's another extremely rare side effect known as Guillain-Barré syndrome, which basically means a person becomes paralyzed almost, unable to move his hands, his legs, etc., and it sort of progresses. Those are extremely rare side effects. The frequency of those side effects is lower than the chances of being struck by lightning in South Africa.
Okay.
So that is the frequency of those side effects.
All right. Is there a way, just and then I'll move on, is there a way that someone is able to pre the vaccine determine their own state of health, and therefore to understand their risks, and therefore to mitigate against those risks before they actually take the vaccine?
Yeah, the problem with that is that the people that are most in need of the vaccine are people that have got underlying medical conditions, whether you've got cancer, whether you've got obesity, diabetes. Those are the groups that are most likely to benefit from vaccination because they are the ones that are most likely to end up in hospital. But there are certain vaccines. So as an example, the Johnson and Johnson vaccine, it's more likely to cause this deep venous thrombosis in women in the reproductive age group between 18 and 45, as an example. So if you want to be ultra cautious, and if you're female, don't get the Johnson and Johnson vaccine. Similarly, so the Pfizer vaccine, as an example, causes inflammation of the heart muscle, especially in individuals between 12 and 25 years of age, boys, males. So if you're a male and you're in that age group and you want to be ultra cautious, don't get the Pfizer vaccine, rather get the Johnson and Johnson vaccine. But again, those side effects are extremely rare. And like I said, most important, people with underlying medical conditions are the ones that require the vaccine the most. And when they're being advised not to take the vaccine because of the medical condition, you're not doing them any favors.
Okay, I think that that's well explained. So you're saying it's, the word is ultra cautious. You're not saying it's high risk to take the vaccine. Let's move on to what you said from the outset, right? That we are at the early stages of the fifth wave, and it's very different to before. So what advice would you give to people? Because we're ultimately talking about human behavior now, right? In terms of social distancing, in terms of wearing a mask, for people of the Muslim faith, and we're addressing them right now. Going to mosques, going for Tarawih. There's Eid coming up. There's certainly a high degree of communal meetings in the next few days. What advice, therefore, would you give people now?
Yeah, so our options have become very limited in the face of the type of variants that are currently circulating. So let us start off with going to mosques as an example. Foremost, if you've got symptoms of a respiratory illness, if you're coughing, if you've got a runny nose, if you've got a blocked nose, don't go to mosque. Not to protect yourself, but to protect the other people that are coming to the mosque. Because included amongst those other people are people that might have underlying medical conditions, the elderly, who even though they're vaccinated, they still unfortunately do have a risk of developing severe COVID. So do the responsible thing. If you're symptomatic, don't go to mosque. You're not doing anyone favors, and in fact, you're doing harm to the community, potential harm. Now, what else can we do? At this point in time, people need to be vaccinated, and that still stays, irrespective of whether they've been infected in the past, because the evidence shows that this combination of infection and vaccine-induced immunity, in fact, results in the most potent protection, not only against severe disease, but also against mild infection. But the other thing that we need to do, it's no longer about wearing masks, because the type of mask that 99% of South Africans wear does very little to protect against infection. But if you're high risk and if you want to take additional precautions, and it's well advised that when there is a resurgence, high risk individuals do take additional precautions, then they need to avoid indoor crowded spaces where there's poor ventilation. And when they are indoors in public spaces, they need to wear what we refer to as the N95 mask or the NK95 mask, KN95 mask. Those are special masks, and they need to wear it properly. And I would only recommend that really high-risk individuals, people above the age of 55, 60, as well, and especially if you've got underlying medical conditions, diabetes, obesity, severe hypertension, chronic problems of the heart and the lung, then take that extra step, especially when there's a resurgence, as we're likely to experience now.
Now, right. So just on the issue of the masks, you're saying the 90% or so of the current masks that we use are ineffective. So why are they ineffective? What has changed in that? They were supposed to be the all-important thing before.
Well, what we understood from masks is that, firstly, we always said right from the outset that the cloth mask that individuals wear doesn't necessarily protect you against being infected, because the virus is able to filter through those masks, including around the mask, because it doesn't have a tight seal around the nose and the mouth. But the main purpose of that mask was to reduce the chances of someone that is infected transmitting the virus into the environment. But again, we have the same problem in that if the mask is not worn correctly, and if it's only a single layer of cloth, as an example, it isn't very effective in doing that. So masks do work, but they only work under the conditions of using the right type of mask and wearing it properly. That's when masks work. And with the Omicron variant, which is much more transmissible, simply stated, the average mask did very little to protect people from being infected.
Okay, so bottom line, finally, we're getting into Eid. Your advice to families meeting up over Eid is to do what?
Yeah, try to do as much as you can outdoors, and especially if there are elderly people, if there are people with underlying medical conditions, think about them. People you can greet with your hands, you can kiss each other, whatever, hug each other. But think of the ones that are elderly, that have underlying medical conditions. Do what's necessary to protect them. Ideally, they should be vaccinated to start off with, and they need to take individual responsibility, or you need to assist them with taking responsibility about wearing a mask and avoiding being in this poorly ventilated indoor spaces.
Well, there we are. That's where we're going to leave it. Professor Shabir Madhi, you always get us thinking, and you certainly got me thinking about a whole range of issues that I'm probably going to share with my family today, not over lunch, but in anticipation of that Eid lunch coming up in a few days' time. Thank you for your time. Most appreciated. Shabir Madhi is the Dean Professor of Vaccinology at the University of Witwatersrand. There you are. Lots to consider coming out of that conversation, and feel free to post your comments on all of these Salam Media social media pages. Tell me what you extract from that and apply that to your own experience, and particularly moving ahead to the last few days of Ramadan, and then, of course, that all important day of Eid. Now, we spoke earlier on about speaking to young South Africans. Here's a fourth South African who has expressed his thoughts around the issue of uh, Freedom Day and what it means for youth in this country, and what does it mean for him. So we're going to get to his thoughts in just a second. Let me tell you as well what's going to come up. We'll chat to Oneza Suleiman shortly about her experience having the Ramadan Umrah. We'll also chat to Wiam Williams and find out how she champions South Africa, and she does it big time. And we'll also chat to Zunaida Musa Vadibal about doing a study on the calligraphy of a few selected mosques in South Africa. And I think you're going to find it really, really fascinating and enlightening as well. Okay, let's get to, we've spoken to three people around the issue of the youth, and in the context of Freedom Day. Let's get the fourth person, and we've got a voice note that we're playing from Akolile Notwala, who's the head of stakeholder engagement at the Philippi Village. So here's Akolile.
Hi, my name is Tolile Nojwala. Am I experiencing freedom in my lifetime? I don't think there is freedom in the sense that we all would like it to be in the country at this point in time. There's certain things that we are free to do, but there's certain things that we are not free to do or free to acquire. More specifically, as black, poor, working class people and communities. Um, to me, freedom means being able to get an education. It means being able to access basic services, dignified basic services, being free to walk, being free to run, being free to exercise, but also being free to live life. And at the moment, many South Africans aren't able to do these things, whether it has to do with access to basic services, where more specifically women are at risk of being raped or sexually assaulted if they have to go to a toilet that's very far, or if they have to exercise, or if they have to run. So those are some of the things that are stopping us, that South Africa is falling short on in terms of freedom. Economic freedom is also a huge part, with such a huge um, unemployment rate among the youth, but across the board. And again, we know who that, in terms of the population and the racial classifications of South Africa, who that affects the most. We might have acquired or achieved democracy, and we are able to participate in democratic activities such as voting. But even that, at certain times, is limited when many of us are trying to acquire more freedom we use some of the democratic means, such as the right to protest, but that is limited because people get shot at, people get arrested. And so these are freedoms that we should be having. Freedom to protest, it's a right that's guaranteed in the protest. Freedom of expression, to air grievances, freedom of movement. These are freedoms that many South Africans are still struggling with. Young people should be playing a role in this quest to acquire full freedom. Young people are the ones that will have to lead this country in the next few years. So if we are not involved in participating in some of these democratic processes that are at least open for us to participate in, then we are leaving the country at the hands of some people that we know are corrupt and do not care about the lives of the many marginalized communities. So as young people, we need to take up space. We need to lead. We need to take up leading positions. And we need to continue and push for the acquirement of full freedoms.
Okay, so that's another voice that we've had regarding this all important issue of the youth in South Africa and what their thoughts are around freedom and Freedom Day. In a moment, we'll be chatting to Uneza Suleiman, in fact, about her experiences during her Umrah experience in Ramadan. Right after this.